This is Akashvani, Mangaluru. Yuvavani. Good evening, listeners. Welcome to today's English Yuvavani program. I'm your host Shazia. Today, postgraduate scholars from Karnataka Ayurvedic Medical College will be presenting a delightful variety program on discussion of Ayurved and information on ayush habba and mahila habba.
Namaste to all. We are celebrating Ayush Habba 2026 during Jan 31st to Feb 1st at TMA Pi Convention Center. All Ayurvedic doctors are going to assemble to take part in this event in our city. In parallel to Ayush Habba, we have Mahila Habba exclusively for women with theme Happy Periods, Beautiful Skin and Menopause. Here we are, the postgraduate scholars of Karnataka Ayurvedic Medical College, gathered to ignite a chain of thought on cosmetology, Garbhini Raksha and menopause in Ayurveda. I am Dr. Chaitra, MD Scholar, Department of Kaya Chikitsa.
I am Dr. Manjunath, MD Scholar from Department of Dravyaguna.
I am Dr. Aksa, MD Scholar, Department of Panchakarma.
I am Dr. Shirashmi M. Shetty, MD Scholar, Department Panchakarma.
I am Dr. Saima, MS Scholar, Department of Shalya Tantra.
And we assemble here with our beloved Madam Dr. Sukanya, Department of Sastarutta. Skin is the largest organ of human body and is very tricky to master. Skin prevents water loss, protects from extreme heat and cold, UV rays penetration and infection. Skin also keeps our muscles, veins and internal organs in their place. Ma'am, what are the factors that can damage to the skin health?
So many environmental factors and harmful lifestyle habits triggers skin health. All are racing towards glass skin. First of all, we should burst the myth that there is no magical product that can glow up your skin within a day. Some conditioning and consistent efforts are mandatory for healthy skin in a sustainable way. Dehydration, harsh substance for exfoliating the skin, excessive washing, age, smoking, cosmetic procedures, too much exposure to ultraviolet light, too much exposure to UV light, pollution, poor blood circulation, poor diet deficiency of nutrients, dehydrating beverages consumption, hormonal fluctuations. These are the behaviors or patterns that can collapse the skin cells. Hydration is life. Continuous dehydration is the senescence. Hydrated skin is plump, luscious and tight, emitting a radiance and glow. Hydration also diminishes the fine lines and wrinkles.
In this Mahila Habba, we are spreading an awareness and education regarding non-toxic and sustainable skincare through Ayurveda. Since time immemorial, human beings were truly indulging in lots of skincare regimens and celebrating aesthetics. We are reminding all the knowledge in an advanced way at our Mahila Habba stall. This will be a unique exhibition of cosmetology and wisdom through the lens of Ayurveda at Mahila Habba in accordance with Ayush Habba on January 31st to February 1st at TMA Pi Hall.
We tend to forget, in understanding our skin type, we are layering our skin with various products without much awareness and knowledge. So, understand your skin type by understanding and accepting your skin conditions. Based on that skin condition, select wisely the ingredients to infuse into your skin. Healthy nutrition, which is homemade and sourced from indigenous vegetables and proteins, are very essential. Consistent exercise routines are also a skincare method. How much you sweat and detoxify your skin, that much your skin radiates glow.
It's amazing to know about various skin types. How do we determine our skin type? What are the cleansing formulations? We know about T-zone and C-zone. T-zone is from the center of your forehead, your nose and chin. C-zone is your cheek closer to ears and jawline. We prescribe the medications based on the skin texture and composition. There are normal skin, combination skin, oily skin, dry skin and sensitive skin. We can explore various skin types and their ingredient profile to be infused scientifically.
Ayurvedic science have a vision on cosmetology. References of Ayurvedic knowledge are scattered in Dinacharya and Rutucharya. Rules and regimen for intaking ahara have tremendous impact in skin health too. Metabolic boosting nutrient absorption always prevents aging. Can you elaborate regarding nutrition on skin health, ma'am?
First of all, we should review regarding the interval of food administration. A 3 to 6 hour duration is significantly important interval between the food intake. Intake only hot water. The cold water, cold milk, etc. can collapse your metabolic strength. It's better to take bath before having food. That always facilitates the digestive fire. As we know, Atmanam abhisamikshya tanmana bhunjita. This is what Acharya conveys. We should worship the food and nourish our body with contentment and full of respect, with sound mind. Include all rasas in ahara. Madhura, amla, lavana, tikta, katu, kashaya rasas can prolong the immunity. Include nitya sevani ahara dravyas mentioned in Ayurveda.
According to Charaka Sutrasthana, 5th chapter, Matra Shiti Adhyaya, Shashtikashali Mudganscha, Saindavamalake Yavan, Antariksham Payam Sarpi, Jangalam Maducha Abhyaset. Shall we decode it? Shashtikashali is which we call brown rice, which enriched with vitamin B1, iron and lots of fibers. And Mudga, green gram, prized for being a rich source of protein in plant-based medicine. Yava we call barley, Saindava, salt, Paya, milk, Sarpi, ghee, Jangala mamsa, Madhu.
And this establishes a well-composed blend of nutrients enriched with proteins, fiber, vitamins, minerals and antioxidants. This is the balanced diet. Avoid incompatible diet such as milk and fish, curd and fruits, milk and fruits, etc. That can damage the cell health and also declines the immune resilience.
Actually, we have a patient at our OP complains of Vyangaroga, that is discoloration in skin. This discoloration is emerging as a symptom. All are conscious about the color and the skin tone. How we can treat discoloration in OP basis, ma'am?
Kunkumadi Taila external application at night is very good measure. We can also prescribe a lepa or face pack with manjishta. Manjishta can be mixed with milk or water or honey according to skin condition. Other amazing formulation for brightening purposes, Eladi Churna face pack. That you can prepare by mixing Eladi Churna, buttermilk and Sariva Churna. Nalpamaradi Churna also have a great therapeutic potential to alleviate the discoloration. Always consult doctor and be aware what ingredient profile is suitable for your skin condition.
Acne vulgaris is another burning issue. This can be associated with lifestyle routine, fluctuation in seasonal patterns, and menstruation. When dirt accumulates in hair follicles and when the sebaceous ducts get impaired to maintain the moisture level in the skin, we get acne vulgaris. So, we should indulge in less oil and increase intake of plenty of hydrating elements like fruits and vegetables. Ma'am, what are the clinical treatment modalities we can do at OP? And I think we can expect a lot of remedial measures and expert advice at Mahila Habba stall.
Some of the effective prescriptions are Lothra, Vacha and coriander Mukhalepa. Neem leaves and coriander paste is a good remedy for acne vulgaris. Eladi Churna Lepa is also very therapeutic for acne vulgaris. Daily application of Rakta Chandana with milk is also a good choice. Turmeric, external application as a lepa. This have a brightening property. Other wonderful remedy which have been practiced is application of Kshara or exodus of raw papaya over acne vulgaris that can bring the results. Other remedy is lepa preparation of green gram powder, turmeric and milk.
Beauty and aesthetics are especially specific to geometric features. Each individual has unique beauty characteristics based on genetics. We can't change, alter or reverse our skin color and skin tone. We must protect and celebrate our beauty and color. Ma'am, what are the formulations we can use to enhance the brightness of the skin?
Yes, exactly. It's dangerous to race behind the surgical therapies and transplantation just to look good physically. All of us are blessed with unique geometrical features supported by genetics. We have to celebrate our genes and preserve the skin health. Barley, yeshtimadhu, lothra together with milk works as amazing formulation to enhance brightness. Cleansing your face with milk is an age-old tradition focused for clean and bright skin. Patients used to come to OP complaints of extreme dry skin. External application of Eladikera Thaila overnight is a good remedy which brought results. Our Shashtika Shali or brown rice have varnya or brightening action. We used to treat patients with Shashtika Shali Manjishta Lepa. Kunkumadi Thaila 2 to 3 drops with milk malai also can cure dryness. And we have medicines exclusively with ghee base that is designed for dryness.
In present scenario, our eyes are tarnished by penetration of blue light from screen. Studies reveal excess screen time can alter the shape and structure of eyes. Beautiful eyes are instruments not only for aesthetics but also for visual clarity. We know our traditions. We know the method of preparation of medicated collyrium, and we tend to forget to prepare the anjana. The medicated anjana improves vision, enhances the growth of thick eyelashes, and cleanses lacrimal duct. Regular application of castor oil over the eyebrows will make them lush and thick. These are traditionally used in practices.
Let's discuss regarding the preparation of anjana. Very first, we collect the essential herbs or drugs needed for anjana preparation and extract their juices. We spread this juice on a cloth and dries it up. We make oil wick out of this juiced cloth in a specific wick dimensions. We use tilataila to light up this wick. A large vessel we use to cover the soot, which will be deposited over the surface. Gradually, we add karpura or camphor and some other medicine to the soot and collect it. Later, we mix the medicated anjana with the drops of tilataila. Daily application of this anjana is very healthy and prescribed for all ages.
Ma'am, what are the eye care in Ayurvedic science?
Ilanir Kudamba is the ideal medicine for adults. This is one formulation of rasanjana preparation which helps to clear the lacrimal duct and blockage. Once in 7 days, application of Ilanir Kudamba beautifies your eyes as well as enhances the vision. Netramrutam 2 drops in eye, morning and evening is also very effective. Chembaratyadi, Neelibringadi, Veliya Chantanadi, Tungadrumadi, Kayunyadi. These are the medicated oils which not only nourishes the hair but also it's very effective for eye care. One simple procedure if you focus, just soak your feet and wash in cold water. That's good for vision. Daily Padabhyanga also facilitates the clear vision.
Ma'am, what are the triggering factors for premature graying of hair? In the present scenario, many complain of premature aging. What are the clinical perspective in the lens of Ayurveda?
In today's world, the scale of stress level is maximum. People love relishing fast food and junk food frequently. Indulgence in extreme hot, sour, acidic, fermented, preserved foods just diminishes the quality of life and immune resilience. Intake of food which is absolutely lack of nutrients and antioxidants can lead to premature aging. Environmental factors such as pollution, stress are also the reasons for premature aging. Kayunyadi Thaila, Balashwagandhadi Thaila, Prapundarigadi Thaila are the best hair tonics clinically proven. Rasayana Aushadhis like Narasimha Rasayana, Chavanaprasha, Brahma Rasayana are also wonderful medicines for the premature graying. Rasayana Aushadhas are our signature formulations. Consultation and prescription is mandatory.
Today's generations are graciously taking up yoga training classes. Yoga has been included in higher primary school syllabus module. Health and wellness are always closely related to lifestyle of an individual.
Lifestyle of a person depends on many factors. Diet preferences of a society's population are revealed by cultural values. Coronary artery diseases are caused due to the sedentary and lazy lifestyle. Habits such as smoking, alcoholism leads to cirrhosis of liver and heart disease. Yoga is a vital element which supports positive health and wellness through holistic nature. Yoga is a tool for life. We can prevent most of the lifestyle disorders through yoga discipline.
Exactly. Yoga training and practice strengthen their health and deal the stress in most effective way. Yoga is one of the health insurance by changing their perception towards stress and physical ailments. There are postnatal exercises, antenatal yoga, pranayama, dhyana that design excessively for maternal health. Surya Namaskara, Setu Bandhasana, Bhadrasana, Uttana Mandukasana, Ardha Matsendriyasana can enhance the pelvic muscle tone and improve reproductive health.
The postnatal care through Ayurveda is gaining much recognition and attention. Mothers come to OP and complaints of stretch marks, breast pain, crevices in breast and other skin problems. Ma'am, what are the regimens suggested in Ayurveda for a mother?
Application of Dhanvantaram Taila, Lakshadi Taila, Nalpamradi Taila can cure the scars, stretch marks, and pruritus in the lower abdomen. The water can be boiled with bala, eranda, nirgundi, and can be used to take bath. Apply Mahatiktaka Grita over breast to get rid of cracks. Ginger decoction can be mixed with milk and given to reduce swelling. Punarnava decoction can be mixed with ghee and sugar to prevent swelling. Moringa leaves fried in ghee can be administered to enhance breast milk. Shatavari Kshira Paka can be administered to produce more breast milk. We usually prescribe Vidaryadi Kashayam for breast abscess. A lepa out of guduji, tila and shatavari with milk and butter can also be applied externally for breast abscess. We have Sukha Prasavada Gridam, which is the best formulation for healthy labor as well as Garbharaksha.
A pregnant woman came to OP with complaints of muscle cramps and varicose vein during 6 months. Is there any methods to prevent it in Ayurveda?
Karpuradi Taila external application and fermentation is a very effective way to cure muscle cramps in Garbhini. A tight bandhana also can be done. Varicose vein is very common among pregnant ladies.
Insomnia is also an associate complaint during the journey of pregnancy. Is there any home remedies so that we can practice it?
In insomnia, a lepa of goduma can be prepared and pasted in a cloth that we spread on the feet of the lady. Internal administration of bala also found to be very effective in nidra.
Menopause is another state of life where all women has go through. Many women complains of depression, severe weight gain and menopause with skin problem. Ma'am, what are the suggestions for healthy withdrawal of hormone in menopause through Ayurveda?
Cucumber juice 200 ml, internal administration at empty stomach is highly recommended. It can control the depressive episodes also. For a lady in menopause, barley decoction, frequent administration reduces obesity. Fasting therapy and Shamana Snehapana also can be recommended during the menopausal stage.
As we already highlighted, Rasayana is unique formulation. Rasayana Sevana can prolong lifespan, immunity and decline aging. What are the Rasayana a woman can intake, ma'am?
Rasayanas are the active formulation with phytosteroidal ingredients. In order to cater the iron supplementation during the blood loss of menstruation days, Dhatri Rasayana can be recommended, which is a reservoir of iron. Brahma Rasayana is another formulation. Shatavari Grida helps and establishes the ovulation in ladies. Phala Sarpis is also a great booster for ovulation.
Menarche in Ayurveda is viewed not merely as a hormonal event but as a result of the harmonious interaction between dosha, dhatu, mala, agni and manas, reflecting overall health and reproductive maturity of the female body. In India, most of the villages are celebrating Menarche or first menstruation of a girl. Ma'am, what is the impact of Menarche celebration? Is there any scientific logic behind that?
Menstruation is the physiological phenomena and it's very normal. This is the instrument for sustaining the human species. Menarche or first menstruation must be celebrated as a milestone event in the life of a lady. The lady gets into tune with menstrual memory and that should be pleasing and memorable one, so that we can reduce the Stigma and anxiety associated with menstruation. The ladies who had menarche celebration reported more psychological well being and less mood swings. Healthy menarche always leads to healthy menopause.
Ayurveda Samhitas clearly narrates the concept of various rituals during menstruation, that is, Ritumatacharya, that includes isolation of menstruating ladies in a hut where new leaves and turmeric are used to decorate. The girl will be using darba mat and given the sweet preparations out of tila, coconut, turmeric, and jaggery. These all measures are intended to prevent the infection and inflammation. Neem and turmeric are always antimicrobial and protective in nature. The lady will be suffering from calcium and iron deficiency during menstrual days. The cramps must be very common, so sufficient calcium and iron rich food like tila, that is ellu, jaggery, and coconut, dry fruits modaka are very beneficial to restore the calcium and iron reservoir. The body of a menstruation lady will be full of free radicals, so turmeric water will be administered for consumption. This can collapse free radical accumulation. The floor of menstrual hut will be painted by turmeric and sacred lime that acts as one of the antioxidant measure.
This session was eye-opening by highlighting skin care, eye care, antenatal and postnatal care, and menopause. We could witness the journey of a woman in different physiological and psychological phases. Yatra narestu pujante ramante tatra devata. Swastha nari samruddha samaja is not just a theme, it is a call to action. By embracing Ayurvedic wisdom and prioritizing women's holistic health, we lay the foundation for a healthier, happier, and more prosperous society. From adolescence to motherhood and beyond, Ayurveda provides holistic care for every stage of a woman's life. In today's fast-paced world, women often ignore their own health. Ayurveda reminds us that self-care is essential, not optional. It's our humble submission and dedication for all the women. Let's celebrate womanhood. Let's celebrate Mahila Habba. We cordially invite all of you to take part in Mahila Habba, which will be happening on January 31st to February 1 at TMA Pai Conventional Hall. Dhanyavad.